Welcome to the KingsCrowd Startup Investing Podcast. I'm Sean O'Reilly, and joining me today is Elemeno Health founder and CEO, Arup Roy-Burman. Arup, thanks for joining me today.
Hey, pleasure to be here, Sean.
Thank you very much. So long time no see. It's been a while since I got to meet a founder in person, but I happen to be traveling on the West Coast, and you happen to be based in Oakland, California. And we got to eat lunch together last week and break bread. It was really, really cool.
It was fantastic. Really great to meet you and the rest of the KingsCrowd team.
It was a good lunch. We unfortunately you had to part ways. You are the founder and CEO of a startup, so your time is very, very busy and stacked. Really quick, can you give us like 2-minute elevator talk on who you are, your background, and what Elemento does?
Sure. My quick background: I'm a physician entrepreneur. 20 years of practice in critical care medicine between Stanford, UCSF, Children's Oakland, and Kaiser. In that world, I've seen that rapidly rising tide of complexity, healthcare complexity, really overwhelm our staff. And seeing the challenge of how do I keep everybody on the same page? And seeing a world where we still resort, like you've seen those pagers, we resort to the binders, the flyers, the emails. People can't get the information fast enough. They can't find what they need. And if they do find it, they can't digest it. So we said, why can't we take that type of information that's crucial to you delivering safe practice and deliver it into bite-sized chunks on any device, whether it's your personal mobile or your desktop, that you can engage it at the point of care or at dark 100 on a Saturday night when it's top of mind. So you can see what you need to do the right way. And if you do it the right way, you're going to decrease practice variation, you're going to decrease errors, you're going to deliver safer care. And as a provider or a nurse, you're going to feel all the more satisfied that you're delivering the best care possible to every one of your patients.
And saving lives, right?
Absolutely. Absolutely. If we didn't, as a nation or as an industry, if we didn't make a single new discovery, if we simply implemented what we already know, healthcare would be leaps and bounds ahead.
That's crazy. So you mentioned like clipboards and stuff. Would you say that by and large, most of America's hospitals are operating like, I don't know, it's 1980 still or what?
Well, if you look at the adage of see one, do one, teach one. That adage goes back to the Middle Ages of when you're the apprentice, right? And then you go and teach somebody else. That still happens in medicine
somebody how to
today.
Use a leech, right?
Yeah, exactly. But instead of see one, do one, teach one, when you're able to capture that in bite-sized chunks, get your rock star nurse showing how I do that dressing change, and you have that in the palm of your hand, you can see it anytime you want. You can see it a million times, and you can do it right every time. So that's technology affords us so much more than what we have already done in medicine. And healthcare, I just need to understand, it's an inherently risk-averse industry.
Right.
It's
they
the
don't
idea
want to
of
be responsible for doing something wrong, basically.
Yeah, you think about the Hippocratic Oath, right? Was
do no harm.
First,
obviously.
do no harm.
Yeah.
Well, if it's first do no harm, I'm just going to sit back and do things the way I've always done it.
Right.
And that's the death knell for healthcare. It's got to be, let's look beyond. And what we're talking about is not some new rocket science. It's applying principles that have been established in most every other industry vertical. Use technology not as a stick to beat me and force me. Use technology as an enabler, as a carrot, to give me what I need in the moment so that I can be better. That's what our healthcare providers want.
That's all. This is healthcare training for the YouTube generation.
Absolutely. I mean, why is YouTube, why is Google, why is Facebook, why are they so successful? Because we can pull that bite-sized nugget of what's contextual and important to me right now. Don't give me the whole textbook. Give me that little bit of nugget that I need right here in the moment. And that's what our Generation Z and our millennials, all of them have been, the joke is they've been born with a smartphone in their diaper, right?
And yeah.
Yeah, I mean, they've known this from such a young age, but so much of our healthcare leadership, technology is still kind of foreign to them.
Yeah.
And they're scared of it. But you got to make that leap, and you got to meet your workforce where they are
For sure.
and deliver to them the information in that the way that they actually want it and the way that they can use it. If you can do that, you're going to make a phenomenal leap in healthcare outcomes.
So you started out, I mean, you've seen some things. You ran ICUs, you've worked at prestigious hospitals, you've done all this. When did you start Elemento?
So there's the idea of starting Elemento, and there's the deeper
Actually
idea.
Doing.
Yeah, and there's the deeper idea of why I did that. From just a very practical sense first, I would thank Salesforce and Mark Benioff and Lynn Benioff for the opportunity to be able to actually develop this idea. When I came to UCSF back in 2011, at that time, Salesforce had put in a lot of philanthropy to the university. And what it also did was brought to us Salesforce to be able to use in different ways, to pilot in different use cases. And I remember asking my colleagues, you guys know what Salesforce does? No. Do you know what CRM is? No. Do you know the cloud or customer relationship management? No.
This is a decade ago.
This is a decade ago.
Crazy,
but what they did know is that Salesforce was investing a lot of philanthropy to improve healthcare. But what we said was, hey, they're using the cloud to be able to deliver information to their clients and to be able to measure what their clients are doing, what their clients want, so that they can better service their clients. Well, how about we use that same paradigm and think about us in healthcare leadership using the cloud to be able to empower our customers in this case being our frontline staff, those nurses, the young doctors, the RTs, everybody at the bedside. Give them the information they need, start measuring from them what they like, what they don't like, what else they're looking for. And once we know that, let's get ahead of the curve. Instead of being reactive to mistakes, let's get proactive, understanding their needs, and let's deliver the content that they need to be able to close those gaps. That was really, CRM was the inspiration for the technical aspect of Elemento.
What does that, so for those that are listening on Spotify and Apple Podcasts right now on their jog or whatever, can you give us a use case for Elemento's frontline product and what a nurse or a young doctor might use this for to basically do their job correctly?
Sure. Let's say that I'm taking care of a patient with a central line. A central line is one of those big IVs that are indwelling for days or sometimes for months. You see that frequently with cancer patients have those, or other critically ill patients. Those lines give phenomenal access to us as physicians to be able to give medications, to be able to measure pressures, to be able to draw blood so easily, because those lines go straight to your heart. The downside is that if they get dirty, the bacteria goes straight to your heart and it gives you sepsis. And if you get an infection through this, likelihood of death is about 1 in 5. So you don't want that to happen. And we know what you need to do to be able to clean it the right way before you access it. We know the right way that you should change the dressing. But so often people do these practices the wrong way. And that introduces risk and introduces infection. So say I'm a new nurse coming in. I've got to change a central line. I can go into Elemento and I can say, hey, here's one of my rockstar nurses peers showing this is how we do the dressing change in our institution with our products, with our devices, with our resources. So it's really custom to what I am doing here.
It's like a video of them doing it.
You can have a video of that that's in that can be in 2 to 3 minutes that they watch right there. Some will watch it right before they go in and do the procedure. Some will watch even the setup on that in the room.
I'd be pausing it the right way. Every few seconds.
You can pause every few seconds. And to that point, how did we iterate over time? We have many other processes that the best way to be able to show that is through snippets. I don't want even the 3-minute video. It may be a series of pictures, key piece of each step, or a series of, GIFs or GIFs, however you pronounce it, that are coming in, showing each step of what I need to do. So I can see that little loop over and over. And I said, oh, this is how I should be holding the needle, or this is how I should be scrubbing the hub, or this is how I should be attaching the syringe. And if I do it consistently the right way, those bacteria don't get in, your infection rates go down, patient safety goes up. So that's one use case.
Yeah,
you can see it there. And another one that I want to share, just because we've all been hit here in some way or another by the pandemic. And to our, colleagues, in the South or some of the other really parts of the country hit hard by Delta, they've got a huge staffing crisis.
Yeah.
Right? You can't hire people fast enough to fill your deficits, and you're paying through the nose to be able to bring in travelers from around the country. But now somebody is brought in suddenly to an unfamiliar environment in a high stress situation.
Yeah.
And so many of them, there's stories of where people have come in and on day one, they've said, you know what, I can't do this.
No, I'm out.
I don't have the support that we need. And, if you look at this on, we often talk about these nurses as our frontline heroes. And now let's think about COVID as being a war. And those nurses are our frontline troops. They're going into battle without the equipment they need to succeed.
Right.
Yes, they've got their PPE and stuff, but it's the knowledge, it's the tactics. How, even as simple in my institution, where's the bathroom? Where are the,
do you have directions for that? I'm kidding.
But it is like, honestly, we've got, when you've got travelers in, it's even a roadmap for my hospital, or where are just basic things that I need to know? How do certain things here work? What equipment do I have? What resources do I have to get my job? And where do I find those things? What are the workflows that I need to do to be able to refer out this patient when they need to go to the ICU? Or if I need to be able to put them on a vent, what are the resources that we have here? Or if I'm going to flip them prone, how do I do that in this organization? That type of information we can have right at their fingertips. So when they come into the stressful instance, they've got the information they need in the moment to be able to succeed.
It's incredibly powerful, because not only does it, how many of us have not asked a question because we didn't want to be embarrassed or something, again, like where's the bathroom, or the boss is busy or whatever. Not only that, but it empowers you to just figure it out for yourself, which is really how most everybody learns it. Truly, you get in there and you do it. And
yes.
Yeah. Very, very powerful.
To that point is that, and we've heard this from many of our clinicians, doctors and nurses, is that I am so busy. I want to do the right thing. If you can give me that information to do it the right way, easy. If I can pull it up right here, I can find it right now, I will do it.
Right.
But if it's going to take me, many minutes or hours to go and find this information, I don't have that time. My patient doesn't have that time. And I'm just going to have to wing it. I got to do the best I can with the knowledge at hand, or I'm going to ask that person next to me and play that game of telephone. How do they tell me to do it? And I'm going to do it that way.
Well, and you're taking time out of that person's day from doing their job. I mean, this is a compounded time suck in a way.
And there's a added twist to what you had said about, I don't want to raise my hand and ask where the bathroom is. In healthcare, in some ways, knowledge is power. And we've got a very old system where, hey, if I know the answer to this, I'm smart. If you don't know the answer to this, you're perceived as not being smart. Well, that's why people don't like to raise their hand and say, I don't get it, because they feel that it's showing ignorance. It puts them down. But on the other hand, when you have that information at your fingertips and you can look at it on your own privacy, that's powerful. That's why already in hospitals, people have been going to Google. They've been going to YouTube. God knows what they're going to find, if it's actually relevant for them or it's dangerous for them. But they're resorting to that because they're desperate for finding ways to be able to get the information they need in the moment.
That's awesome. Really, 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 really powerful tool there. How many hospitals have you signed up so far?
We are
in the publicly.
in the mid-20s.
That's awesome. Are they all out in California? I think you mentioned some.
No, they're around the country, both West Coast, East Coast, and in the South. I am proud to say that we have clients in blue states and in red states, and they are all sharing knowledge and collaborating with each other.
Awesome.
We have common ground because we all want higher quality healthcare at a lower cost.
Fantastic. Arup, the real reason I wanted to have you on the show was, our listeners, they're primarily early stage, startup investors. KingsCrowd is a startup investing platform. And whenever I talk to a founder, there's always something I learn about that can be applied to other situations, much like you're sharing knowledge with other healthcare workers and everything. And your story was so fascinating me because it reminded me of a talk that Simon Sinek gave. That he's like a coaching corporate consultant guru guy. It was like a TED talk in 2010, but it was titled "What's Your Why?" and it talked about the differences between like an Apple and just another computer maker or something. And he was like, what makes the difference? Why is Apple so much better? And it's because they flip it around. Most people start with, hey, we make great computers. And I don't know, brand new Hewlett Packard, it's probably a great computer. But Apple flipped that around and they say, we believe in thinking differently and outside of the box. We do that by empowering creators to think outside the box themselves with great tools that are easy to use. We happen to make computers. Do you want one? And it's like a mic drop moment there, but it's true. And listening to your background, I realized like, wow, this founder who, founders and CEOs, like majority of the time with a startup, we're betting on you. Like it can be a great idea, a great product, that's lovely, but it's mostly on you,
Mm-hmm.
And you had a heck of a story. And so I wanted you to share a little bit about that, because not only is your why a powerful endorsement of you and what you're building at Elemento, but I don't know. I hopefully our listeners today take something away in what they should be looking for in other founders.
Sure, appreciate that opportunity. And I want to preface this by saying that the story I'm going to share with you all is not one that I've shared much publicly prior to this. Only recently have I opened up about this, and that's after getting a kind of green light from my family on this and really seeing the positive nature of it. So let me share with you, Sean, here, my why. And here I'm sharing on the screen. This is my sister, Urmila. She was born end of 1971. And at that time, she was born with congenital heart disease, ventricular septal defect. It's something that is pretty standard nowadays. And she was cared for very well by one of the premier children's hospitals here in California. So in 1976, when I was in second grade, my sister went to the OR for a very simple surgery. That was supposed to be her final surgery for treating her heart defect. And she went into the OR, went under anesthesia, and something went wrong. There was a mistake. And with that error, she died, and she died in the OR.
Wow.
It was devastating, to say, for my parents, something that they still remember like yesterday. And, I remember being at home after school. It was like the second to last day of the school year. And the phone rang, and the sitter handed the phone to me, and my parents told me.
Oh, man.
And
you obviously never forgot that.
I never forgot that. My family was blessed in that I had another sister born a couple years later who looked remarkably like Urmila, and who's gone on to become a doctor herself. But for Urmi, that memory has really been seared in my family's mind. And I have no doubt that subconsciously she was the driver as to why I went into medicine. I went into pediatrics. I then went into
you mentioned that.
Critical care.
Yeah.
And then taking care of children with congenital heart disease. So, she's my why for why I went to medicine. She's my why as to why the impact of medical errors is very near, dear, and personal to me. And when I continued to see patients die from preventable mistakes in top tier institutions, mistakes made by well-intentioned, hardworking, well-educated staff.
We're all
Simply
human, though,
all human, yeah. And they,
Yeah.
they couldn't pull the information they needed when they needed it. It's not like 100 years ago where maybe a nurse had, 10 things that he or she had to master.
Yeah.
Now it's like hundreds, thousands. We can't realistically expect anybody to do that. And so why can't we, through technology, help them? And if we do that, we can avoid having those types of mistakes that affect other children, other adults, other families. Because as a healthcare system, there may be an error and it goes down as just a statistic. But for the person or the family involved, it can be a life-changing,
Never goes away. You can
and
tell. Yeah,
unforgotten event that lasts with you for the rest of your life. So
thank you.
That's my
thank
why.
you for sharing that. That's a very big deal. Yeah, that's so powerful. So you're honoring her memory in the best way possible, it seems.
I had an interesting experience where I hadn't shared this story publicly until a little over a month ago. I was invited to present to an organization called the National Patient Safety Board, created by patient safety advocates, somewhat analogous to how they want to be like what the NTSB is to the airline industry. And they talked about the value of how to be able to take safety policies to practice. You need to partner with industry. And that's why I was invited. And given that this was an audience of patient safety advocates, I shared my sister's story. And after receiving a positive response from different members of the audience, I relayed that to my parents. I had not liked to talk about this because it was a painful memory
It's so
for the
painful.
family.
Yeah. So painful.
And I was, my parents said, one, it's wonderful that you still remember her so well. And for us, that means a lot because after we're gone, you're the last family member who remembers her. And the other one was, we're happy that what happened there has been used as an inspiration for helping so many more people. And that comment from my folks really made me comfortable with sharing the story and really honoring her memory in a way that can help so many more.
For sure. That's awesome. Not to reduce any family's experience to a statistic, but do you have any data you can share on how prevalent these problems are in our nation's hospitals?
So, all right. So I'm going to give you a couple of different problems that we're helping with. The immediate one that everybody hears about is staffing and the staffing crisis. The Bureau of Labor Statistics estimates that by 2024, we're going to have a deficit of 1 million nurses in the United States. That means there are going to be 1 million openings that are not full. The reason for that are multifold. One of them is that nurses who have had a long career, the boomer generation, are retiring. So they're leaving from the workforce en masse. COVID has actually accelerated that process. The other one is that as those boomers retire and are moving into, needing more complex care that both patients and payers now want, not in the hospital, but in the skilled nursing facility closer to home, or in home care, actually in your house, that is increasing the demand for caregivers coming out there to support them. And the increased complexity is requiring more people to be able to support it. So you've got a problem with both supply and demand.
Right.
Here. Yep.
Like this is,
So that gap is huge. And then, the way that what nursing's had to go through in this past few years, it's not the most attractive job to jump into. Granted, salaries are going up and comp is going up.
Yeah.
But it's a tough job. And if your pipeline is also drying up there, that's going to contribute to the issues. Now, if we look in the situation of doctors, everybody's now familiar with nurse practitioners and physician assistants.
Yeah,
These are,
we all hear that, there's a lot of things nurses can do these days if given the training, that you don't necessarily need a doctor.
Exactly. So that way we're able to work with the limited doctor supply by filling the gap with some of the nurses stepping up into these roles. Similar to that, you've got a gap of 1 million nurses. You will have others who are maybe a little less trained than the nurse, but who will need to help to step up to start to fill that gap. And for getting those people to be able to move up, nothing's better than giving them contextual training in the moment. You're not going to be able to pull them into years of classroom training, but what you can do is give them that information at their fingertips. So these are different ways that, we're helping on the nursing crisis with being able to onboard your staff faster, shorten that time to value, being able to support them so that they stay longer, but we're also able to help all the others level up to top of license and to be able to unburden those areas where we have so much strain.
Is there, so who would need to step up to fill the shoes of what the nurses used to do? Are they people that have certificates or technical?
You can have the LVNs, the LPNs. You can have the medical assistants who can step up to fill some of the gap, not everything, but they can fill some of it. And frankly, what's ultimately going to happen is more and more people at home, families, are picking up the brunt of what's needed.
That's been happening with COVID too.
Absolutely.
Yeah. What are there enough, LPNs and everything to fill that 1 million person gap, or are we in for a world of hurt here?
I think we're in for a world of hurt. We've got to start doing what we can now to be able to mitigate that. And I have no doubt that family members, lay folks, are going to have to step up to be able to help. And they're deathly scared of this. So, we're gonna have to find ways to be able to support them in the moment.
Is your product currently available to just me if I want it?
So we have product demand from our clients, from healthcare systems, to be able to make a version that can be family facing. Okay. That's something that's on our roadmap, but it's not in our immediate right now business plan, which is focused on frontline staff.
Yeah,
it's coming. Yeah, and now when you talked about the problems, we talked about staffing there. The other big area that, of course, was our inspiration was errors.
Yeah.
And, medical errors had been, for the past several years, the number 3 cause of death. At the moment, COVID has surpassed it.
Yeah.
But errors are
heart attacks.
Huge. You have heart attacks and cancer.
Yeah. Okay. Yeah. So.
Yeah.
Wow.
And
so more than strokes, more than.
Yeah.
Car accidents.
There will be
attacks.
some people will some people will on that piece of attribution. Well, was that really due to the error, or was it due to their underlying disease? The underlying disease brought them to the hospital, but then the mistake happened. So it's a contributor in some way or form. And if you take the stat of how many people die from medical errors, it's the equivalent of like 2 747s crashing every day.
Which would make news in every way.
Absolutely.
Yeah.
Absolutely.
Today, 2 planes crashed into.
Yeah.
Wow. How many people fit on a 747? Is it like 200 people or something?
I think it's like 300 something.
Wow. Yeah, so this is 600 people a day, give or take. That were
600 people a day. Yeah.
Wow. Yeah. And is that is it? So the thing you mentioned earlier was kind of sanitation in a way, the direct line to the heart with the bacteria and everything.
Mm-hmm.
Is that, so that's taking in everything. So that's not only sanitary, like doing the line properly, but also like, I doubt this actually happens that much, but like, nicking the wrong artery in surgery or.
So there's 2 things. There's one about how do you insert something and how do you maintain it.
Yeah.
On the insertion end, that's often done much more by the physicians and the associated physician extenders. They're the ones who are generally doing those. But the same thing we've had for our doctors, examples of playing that same central line.
Yeah.
We've had at one institution where the residents in training have said, every attending physician tells me to do this a little bit different way. And I want to know what's the right way. So the faculty got together and said, look, this is the best practice. We're elementaizing that. And now every resident, as every resident comes in, it's like, oh, I see there's the standard approach. I've got that there. I can do that. And what was super cool with this is that, they had kind of the step-by-step on how they place that central line. And they started off with a picture of their supply cart. Hey, this is in our ED. These are where the pieces are that you need to get to make it easy for me to find it. And so then they made it shareable. So another ED hundreds of miles away said, ooh, I like that content. I'm going to approve it for my house. Except for what I'm going to change is the supply cart, because I got a different supply cart, but the rest of the procedure is the same. So I customize it for my house. I'm not reinventing the wheel. I'm sharing knowledge from what my peers have already done successfully.
Absolutely awesome. Well, Arup, thank you again for sharing, your story, your mission. I think we can all learn a lot from you and your family's journey. If people are interested in learning more about Elemento and your current fundraising round, where can they find you?
Yeah, so you can find us on Start Engine. So if you go to the platform startengine.com, look for Elemeno Health there. I think we can share out some other links. You'll look for Elemeno Health on social media.
For sure.
You can find us through there.
Awesome.
I want to call out that for the investors on the crowd, I am thrilled that we have our clients in the mix. That is nurses and doctors that we are serving.
You told me that at lunch.
Yep.
They've come nurses. That's right. That was so cool.
And that was really the impetus for us for doing the crowdfunding, is that when
the nurses were like, hey, that's awesome.
I want to invest in this. I want to be part of it. And so we invite other frontline heroes to join. Everybody's a patient to join. Our goal is to create a movement. It's not one that we just need to push down to say, this is the safe practice or this is the safe way to do. We have a vision where every hospital has their patients saying, look, I understand that my providers, my caregivers are all human. I want to make sure that they are empowered with technology at their fingertips so that they can deliver the best care to me. And in that way, we want to create that pull in the organization to bring in safety solutions. Ideally us, but frankly, in the big picture, if anyone else comes around like us, so be it. But be able to empower our frontline heroes so that they can succeed and deliver the best care possible to every life they touch.
That was awesome. Thank you again. I will put the links in the description. And I hope to see you again soon.
Sounds good, Sean.